인클루시브 코리아 2021 제2세션 시작하도록
Let us begin session 2 of Inclusive Korea 2021. Let's invite our first speaker.
도시보건대학원 임준 교수님께서 준비해 주셨는데요.
We will start with Professor Im Jun's presentation of the University of Seoul, Jae-in Care and Reinforcement of Health Services. Allow me to speak under the topic of Jae-in Care and Reinforcement of Health Services. I am Im Jun of University of Seoul. I will be talking about the healthcare of Korea as well as the tasks at hand. And so I will be speaking under this topic for about 20 minutes. I will be focusing on some issues as I cannot cover the whole of the topic in just 20 minutes. Let's take a look at the necessity for reforms. And I will be mostly focusing on how there has been a failure in the market-oriented approach. And we need to take a look at healthcare from the perspective of being a right of the people. And we will take a look at the achievements of the Jae-in Care as well as the reinforcement of health systems and the delivery system reforms as well. Well, I believe that healthcare is a crucial topic in Korea because of the aging, the decrease in population, and the increase in chronic patients. And we need to make sure that we change our systems to the chronic patient-centered system. We see that there are chronic patients with multiple diseases, and so we need to think about whether the existing system is still viable in the current situation. Up until now, we have had healthcare focused on treatment, and it was provider-centered. And with such an approach, can we actually fulfill the new needs in our society? Well, in the past, we have been treatment-centered because the healthcare sector had a provider-centered market system, and so the large hospitals centered in the capital area, filled with better budgets, have accumulated more patients, and the regions in the rural areas, they have a larger need for such hospitals, but because of their low purchase power, they have not had great hospitals in their regions. Because our services are centered around treatment, it seems that we have not been able to deal with the welfare side of treatment. And so we have not been able to reflect the multifaceted requirements for healthcare. The large hospitals, they are focused on technical treatment, but they have also not been able to provide services that reflect these multifaceted needs. Well, we can see that there are increases in beds around the world from 2000 to 2018. According to the OECD, we can see that Korea has seen an increase in beds per 1,000. And you can see that other countries see a decrease in the number of beds per 1,000. The only other country with larger number of beds per 1,000 is Japan, and they are decreasing their beds. And in Korea, we see that we are continuing to increase the number of beds per 1,000. And we have a shortage of manpower. We always talk about the shortage of doctors and nurses. And it's not only about the quantitative side. Not only do we have a quantitative shortage of doctors, but we also see that because we have a large number of beds, and we don't have enough doctors for all of the beds, that is an acute problem in Korea. You can see that the number of doctors per bed is increasing in other countries, but not in Korea. Of course, we do have an increase in the number of doctors, but we also have an increase in the number of beds per 1,000, and therefore that ratio continues to remain the same. This is the same for nurses as well. we have more nurses, but we also have more beds available. And so we see that the ratio between the nurses and the beds continues to be maintained at a low level. Of course, we are providing various services through nurses, but there is the issue of sufficient quality of healthcare services. We also have to take a look at the public infrastructure. I'm not saying that private hospitals cannot provide public good, but we also need a certain percentage of beds at public hospitals in order to make sure that we have a sufficient public infrastructure. This is a policy need. In Korea, we see that there is a very low percentage of beds at public hospitals compared to the total infrastructure. And so you can see that the percentage is not only low, but it is getting even lower. And we also need to take a look at the gap in death rate by regions. While the overall death rate has been lowered dramatically because of our healthcare system, our health insurance system, but we see that large hospitals are concentrated in the capital area, and so the overall average death rate is continuing to be lowered, but there is this gap in the death rate by different regions. As I mentioned before, there is a large gap between the capital area and the areas outside of the capital area. And if we divide Korea into 70 different regions, you can see that there is a big gap between the different regions. And for those regions with higher death rates, we see that those are the hospitals, those are the regions where there is a lack of large hospitals. So if there are diseases such as cardiovascular diseases that depend on time for the treatment, they have higher death rates because they don't have adequate hospitals to treat these diseases. The right to health is a universal right, and so the UN and the WHO has guaranteed such rights. But are those rights being guaranteed in Korea? Our average death rate continues to fall, but what about the gap in the death rate by different regions? That is a fundamental issue that we need to take a look at. Given these circumstances, if we take a look at medical expenses, because we have a higher level of health care, and we also have a high coverage of the healthcare insurance, then we can see that the burden is not that high compared to other countries, and many people believe that this is very efficient. But is this sustainable? Will it be sustainable in 5 years? Here you can see the increase in our medical expenditures. It is increasing quite drastically. With the exception of the US, the OECD members have seen a plateau in their expenditures somewhere between the 10 to 15%. But in Korea, we see an increase that is quite drastic. And so we believe that we will surpass 10% of our GDP by the year 2030. And so, will we be able to sustain the current healthcare system? That is a fundamental issue that we take a look at. In the past, our expenditures were very low, and so we believe that it is sustainable. But in the future, it may not be sustainable, especially given the aging of our society. As a consistent, we believe that the increase in expenditure will continue to spike up. Then we have to take a look at the public side of public health services. In the past, we always took a look at health services as a good to be provided in the market. And so we are vulnerable to market failures. For example, asymmetry, externalities, uncertainties, and also the differences in different types of healthcare services. And so we are quite vulnerable to market failures. We need to now take a look at a new approach for healthcare services. Not only do we need to take a look at financing, but we also need to take a look at this from the side of a universal right. We need to make sure that we enhance our right to health, and we need to make sure that we don't use the phrase public healthcare, because all healthcare should be public. In this process, we see that we have a high reliance on medical experts, and so how are we going to make sure that they use their expertise to provide public goods? Up until now, such social aspects were not emphasized, but now we need to take a look at these social aspects in the Korean society, especially given the gap between the capital area and the non-capital area, and where inequalities are growing. And we see that aging is leading to higher medical expenditures, and so if we concentrate on just treatment, then we will continue to see a spike in medical expenditures. So, of course, we should also take a look at how to solve market failures, but we also have to take a look at the public side of the healthcare services. Up until now, we have always focused on finding solutions for market failures, and we also wanted to always think about the access in terms of economic affordability. And therefore, that actually translated into enhancing coverage to solve the market failures of the healthcare services. In this process, the service delivery system was more focused on providing higher coverage by the insurance system and to provide more premiums for the vulnerable groups. I'm not saying that we should move away from these types of solutions, but we need to make sure that we focus on the fact that medical services are a universal right for all people. And so that is why we need to strengthen the public aspect of healthcare. We also need to focus on caregiving, and these are new issues that are rising. Now let's take a look at the Jae-in care. Traditionally, that is to strengthen the coverage of our insurance system. So during the last 4 years, we have focused on enhancing coverage. But the enhanced coverage did not happen before the Jae-in care. And the core of Jae-in care is to strengthen not only coverage, but also to solve the issue of treatment that is not covered by insurance. So those treatments that are not covered by insurance are then classified into reserved coverage. And we believe that in the past, the cost to effect was analyzed to decide whether coverage is needed for certain treatments. But if there's a medical need for such treatment, we will include those treatments as a reserved coverage, and then we will have gradual transformation to coverage. That was actually quite innovative. And so the goal is to have 70% coverage by the health insurance system by 2022. We see that the overall coverage was increased from 63.8% in 2018 to 64.2% in 2019. And we believe that we can set a goal to about 70% in 2022, possibly more realistically 67 or 68%, but we see that there is an increase, especially for the seriously ill. But the issue is that when we enhance coverage, there are still issues that remain. For example, the innovative ways of covering treatments that are currently not covered by the healthcare insurance system. We see that coverage for small clinics actually decreased, and there were also coverages for treatments that were not medically necessary. And we also see that we believe that there will be a decrease in healthcare for disasters, but we see that that is actually increasing. Coverage should be concentrated on the vulnerable groups, but we see that that has not happened in the actual results. The coverage system is just for medical cost. It does not find alternatives for the decrease in income triggered by illnesses. For most advanced countries, there are allowances for the sick and wounded, and we do not have that in Korea. The allowance for the sick and wounded is not just for the loss of income, but it also covers rehabilitation following disease treatment. And we see that this is not covered by the Korean insurance system. So the allowance for the sick and wounded not only compensates for income loss, but it also is a way for us to increase the health condition of the patients. So the Moon Jae-in Care actually works on strengthening the universality. For example, if some of the treatments are reserved coverage, but because it is not included in the coverage of the insurance, so that actually does not decrease the cost of the expenditures of the vulnerable groups. And so, of course, we can set temporary limits to these coverages, for example, to 5 years before we make them permanent. And especially in this aging society, we need to make sure that we don't concentrate only on treatment, but also enhancing wellness. And so that is why we need to work on the reforms of our system. For example, the allowance for the sick and wounded to compensate for income loss. And I understand that there is a trial project being planned for the allowance for the sick and wounded. Who will be included in this trial and how much of an allowance will be set? Those are issues that we have at hand. We also need to make sure that we strengthen the public side of healthcare. I'm not saying that all hospitals should be made into public hospitals. Well, the private hospitals, they play a major role in providing healthcare services. But we need to make sure that there's a public aspect of the private hospitals. But the private hospitals are market-centered and they are profit-centered. And in order to overcome these limitations, we need to make sure that there are systems in place to keep the hospitals in check so that we can actually play out our policies so that the private hospitals can, through a private-public partnership, provide adequate healthcare services. But such a public infrastructure is very weak in Korea. So we need to make sure that we expand public infrastructure in order to keep the private sector in check. And we also need to make sure that there is a fair and equitable distribution of resources. In the past, the government actually focused on having public hospitals to provide services for the vulnerable. But what we need to do is to include the 5 areas of safety and the quality of life for the people so that we change our concept of public health care to a universal right to health. And so not only are we going to include public hospitals, but also hospitals that strive to achieve public good. And we can see that we have set the goal of having at least 1 public hospitals per region. And of course, the private hospitals, if needed, they need investment from the government. But we need to make sure that we have these public hospitals in place so that there can be adequate private-public partnership. And we also need to take a look at how to make sure that the for-profit hospitals can strive to provide public goods. We need to have adequate public hospitals that can keep private hospitals in check, and especially in rural areas where there is no adequate private hospitals, the public hospitals can become a necessary infrastructure. Of course, the manpower is very important. We see that we have a lack of doctors and also an asymmetrical distribution of doctors. So we need to make sure that we foster more doctors, especially for public hospitals. And we also need to solve the lack of balance in the distribution of doctors for different regions. The overall quantitative and issues should be solved by setting up smaller medical schools around the country. And we need at least 50 doctors that have a specialty for hospitals with 300 to 500 beds. But currently we have about 20 doctors for hospitals with 300 to 500 beds. And so what we need to do is to make sure that we have a structure where even the smaller hospitals can attract talented doctors and nurses. So in this process, we need to have an adequate healthcare delivery system. Up until now, our systems have been focused on the market and purchase power, and therefore we have had large hospitals focused in the capital area. But as I mentioned before, we have aging in our society, and we have chronic patients, and we also have patients with multiple diseases. And so we need to have a system to solve these issues. Not only do we need expert hospitals, but we also need to have primary care. As you're well aware, we have the lack of appropriate primary care systems because we have large hospitals concentrated in the capital area, but there is a lack of hospitals that can take care of the primary care side of healthcare. And so that is why we have a trial project for chronic patients with diabetes. And so we need to expand these care systems. And we need to also make sure that the hospitals are not given budgets according to treatment, but according to their performance. And we need to make sure that patients can lead their treatment. And so we need to make sure that our healthcare system is not provider-centered, but consumer-centered, and we need to have incentives to make that switch. And we also need to make sure that these healthcare systems should include all of the life cycle phases, including aging. And that is why we need to reform the function of the health centers. Well, in other countries, the public healthcare centers are operated by the local governments, and there are primary care clinics in the local areas. But in Korea, the primary care clinics do not play a large part, and so that is why the public healthcare centers provide that role. And I believe that this structure will continue to be maintained because there's not sufficient primary care that is provided for the needs of the people. And so what we need to do is to work on strengthening the function of primary care and care for the elderly at different public healthcare centers. And in the process of expanding these systems, we need to make sure that there is a healthcare delivery system established to connect the primary care all the way to the large hospitals. We should not provide coverage just for treatment, but we need to provide coverage for healthcare itself. And we also need to provide incentives for taking care of the patients comprehensively. And in this process, we need to expand the public aspect of our healthcare so that we can have private-public partnership. The primary care should be focused on walk-in patients, and the hospitalized patients should be the focus of the large hospitals so that they are not in competition, but rather supplementing each other's role. And so we need to actually have an incentive system that can support such a change in the Korean society. I believe that that would be very important for Korea. This brings me to the end of my brief presentation on the Moon Jae-in care and reinforcement of health services focused on the tasks at hand. Thank you very much. Thank you very much for your presentation.
Let us go on to listen to the second presentation. Research fellow Cho Sung-eun of the Korea Institute for Health and Social Affairs will speak on the topic of the social safety net and the expansion of inclusive welfare. Please greet him with a big round of applause. Yes, as was introduced, my name is Cho Sung-eun, Research Fellow of the Korea Institute for Health and Social Affairs. After receiving this topic, I thought about what I should talk about. And if you look at the activities of the Moon Jae-in administration, I think it's a little bit too early to evaluate the outcomes and achievements, because especially in the social sector, we need long-term review and evaluation. So if we look back at the input for the past 4 years and the minimum output that has come out of it is all that we can talk about at this point, in my view. I don't have a lot of time given to me, so I will focus on talking about the policy directions under the Moon Jae-in administration and whether such directions were appropriate within the Korean society. And also, I will take a look at some of the outputs and figures that we can say are outcomes at this moment. And also, I'll take a look at the challenges as we go forward. So this is the contents of my presentation. First of all, I will talk about the inclusive welfare state vision and think about the quality of life and distribution structure in the Korean society. And also I'll take a look at the achievements or outcomes related to inclusive welfare. And last but not least, I will talk about the remaining challenges for Korea to emerge as an inclusive welfare state, which is the vision of this administration. So first of all, let's take a look at the distribution structure and the quality of life of the Korean economy. As you well know, the high growth rate of Korea has become something of the past. Now Korea has become a middleweight country or a middleweight economy, and so achieving such a fast economic growth rate is not easy. And also we're seeing the industry structure fastly being restructured. At such a time, we are seeing polarization in our society and our economy. I think that is inevitable. If you look at the bottom of the right side, you can see that that is the market income and Gini coefficient and inequality of income. So, based on the market income, the Gini coefficient is deteriorating from 0.311 in 1998. It has expanded to 0.406 in 2016. Even before the Moon Jae-in administration was launched, still we had polarization issues in the market, and the governments were trying to ease such polarization through redistribution policies. There was an urgent need for such policies, but such policies were not very effectively implemented. And so the Moon Jae-in administration came in and started to focus on such policies. So I will focus on Social Security, not Moon Jae-in care, because my given topic is Social Security. But the administration focused on strengthening the basic livelihood security system and also Moon Jae-in care and other innovative social policies so that the quality of life can be improved. And I think that this is a major accomplishment for the current administration. So enhancement of the quality of life was pursued, and we can see some tangible results coming out of such efforts. Also, in terms of social policies, you probably know this very well, but the low birth rate and the aging society has become a predominant challenge of the Korean society. And so in Korea, the challenge of distribution is closely linked with the population structure. So I will not go into detail about this, but the aged population accounts for a high percentage of the low-income bracket, and you can see that this is actually a structural issue. The low birth rate and the aging society, well, after the pandemic broke out, and this became an even more serious issue for Korea. And in Korea, the out-of-wedlock birth rate is quite low, and Actually, that is one way to explain the low birth rate. After COVID-19, the number of marriages have been declining, and so I think that this will lead to an even lower birth rate. If you look at the graphs here, well, starting from 2019, you can see that the number of deaths is greater than the number of births. So natural decline in the population is expected, but the problem is going forward. In order to resolve this issue, as you can see on the right side, if we leave the status quo as is, the challenges might become more severe, and so we have to make efforts so that we can recover the birth rate to the level at least that we hope to achieve, and this is based on a recent study. And so that was the starting line of the Moon Jae-in administration. There was a need for enhancing the quality of life when the Moon Jae-in administration was launched. And not only the market wage, but also social wage and taxation burdens are all factors that influence the quality of life for the people. And so we have to focus on all of these factors, especially the ultimate disposable income. So the disposable income combines all of these different factors together. And we have to look at the ultimate disposable income to see and evaluate whether we are adequately dealing with the market challenges. So I will be touching upon that as well. Korea has been expanding welfare to achieve an inclusive society, and that is a major goal of the Moon Jae-in administration. And to evaluate the efforts, I think that we have to focus on two parts. First of all, has the government policies improved the quality of life of the people? In what way? So it's not just about whether it has improved the income level, but what are the tangible results felt by the people? That is something that we have to focus our attention on. And number two, we should not look at the outcome of the one-time policies, but the continuous, consistent policies. So on the right, as you can see, expanding the social policies is not enough, but rather we have to think about how such social policies have led to innovation and job creation and improvement of the economy. So in other words, have we made the active social policies a part of our social fabric? Has there been significant improvements made through such active social policies? So let's take a look at some of the outcomes that we can verify at this stage. With the launch of the Moon Jae-in administration, well, in July of 2017, the 5 policy goals were announced. And among the 5 goals, I think that a nation taking responsibility for each individual is a goal that is in line with the topic of my presentation. So under this goal, there's a strategy of providing inclusive welfare and also providing full government support for childcare and education. I think that already healthcare was mentioned by the previous speaker, and I understand that childcare will be presented by my next speaker. Anyhow, the Moon Jae-in administration wanted to have more people benefit from government policy so that more people are included in the society. And this inclusiveness should lead to a stable life for people. That is what was pursued by the Moon Jae-in administration. So the tasks were more detailed, but if we look at the 3 visions for creating an innovative, inclusive society in terms of the social policies, there was the vision of strengthening social integration. So through inclusiveness, social integration was pursued, and this was to be linked with the core capacities. That was a very important policy vision for the Moon Jae-in administration. In this process, well, because of the time constraint, I cannot evaluate all of the visions and the strategies, but if I may touch upon a few, well, first of all, quite a number of people talk about the effects that they have experienced when they evaluate the policy outcomes of the administration. I think that when it comes to the inclusive welfare policies and the expansion of such welfare policies, the ones that have had tangible results and felt by the people are as follows. First of all, I think that one of the outcomes was the rapid contraction or the decrease of the gray areas of the basic livelihood security system. So the persons with duty of care and the recipients, well, they actually were excluded from receiving the basic livelihood security, but that was taken care of. And as you can see here on this page, from 2017 to 2021, you can see that the number of recipients, which was 1.58 million, increased to 2.23 million in 2021. So that was a rapid increase. So against the total population, 4.32% of the population was able to receive the basic livelihood security support. The rapid increase of the recipients of the basic livelihood security system is actually a great accomplishment, considering that the number slowly increased from 2016, just right before up till 2017. And also, there was a rapid increase of the basic pension and the pension for the disabled. So there was gradual increase, and in 2019, there could see that the pension for the disabled was increased to 300,000 won in January 2021. These pensions actually was expanded to help the vulnerable in our society, to provide them with cash benefits so that they can at least enjoy the basic needs or have the basic needs fulfilled to carry on their lives. So there was an increase of about 40% in terms of recipients. And the basic pensions and the base pension for the disabled, the reason I'm mentioning these pensions is because the efforts that were put into the expansion of these basic pensions were not really felt by the people, because unless you're part of the group that's part of the recipients, you would not be able to notice the difference. But there were indeed a lot of effort put into this. And also, you can see that public transfer had really helped improve the inequality in the market. And here, the blue actually shows the Gini coefficient in terms of market income. And also, here also, the lower blue here is the disposable income Gini coefficient. So the top dotted green line is the market income-based Gini coefficient. But if you look at the Gini coefficient based on the disposable income, you can see that there is a rapid decline. So the green line and the blue line in between, you can see that the gap is widening. This means that public transfer actually is proven to be effective in terms of redistribution. And also, if you look at the relative poverty rate, the graph in the middle, you can see that the blue actually is for the market income, and also the red is the relative poverty rate in terms of disposable income. The relative poverty rate in terms of disposable income is going down. The one based on market income is not going down, but you can see that the orange line is going down, and in 2019 reached 16.3. So we made a bar graph for the relative poverty rate, as you can see in the bottom of the page. And the policies were expanded for the vulnerable group in our society. And I do believe that there was indeed effect in terms of reducing the relative poverty rate for the vulnerable groups in our society. And also there were concerns that COVID-19 would further deepen the inequality. However, there was emergency financial support provided, for example, and also, at the same time, there were some support provided for the vulnerable groups in our society, which proved to be quite effective. In 2019, the first quarter, before COVID-19 broke out until 2021, you can see that here you can see the Gini coefficient for the disposable income. And if you look at early 2020, for example, the first quarter, you can see that there is a slight increase compared to the previous quarter. That's right before the outbreak of COVID-19. But if you look at the second quarter, and the third quarter 2020, the inequality here has improved compared to the previous year. And in 2021, in first quarter, the Gini coefficient went down slightly to 0.331. So you can see that inequality has slightly declined. And so the swift financial support helped ease the inequality, or at least blocked or prevented the worsening of inequality suffered by the vulnerable group in our society, driven by COVID-19. I think that such distribution policies were not noticed or given credit for by many people. And I want to make that point, however, that those were indeed somewhat effective. So I talked about the vulnerable group and the social policies for them. And now I would like to talk about inclusive welfare expansion and the effects of that in the Jae-in administration. Now, in terms of social investment into children, there was, first of all, the expansion and introduction and expansion of the child allowance. I think that this is a major accomplishment that can be emphasized. Actually, the child allowance requires massive amount of budget, and it was unclear whether or not it would be possible to implement the child allowance. But right now, 2.8 million children under the age of 7 receive the child allowance. And also, after COVID-19, the child care vouchers are being provided so that child care services can be provided through the public sector, and that the government and the public sector is investing in child care. In order for such efforts, however, to lead to significant benefits and accomplishments, we would have to see the birth rate go up. But it's difficult at this time to already recognize or see that. But nevertheless, by investing continuously and widening the investment into child care and children, the government is clearly sending out a message that it is willing to invest in children. And also, there was an implementation of free education for elementary, middle, and high school students. And in terms of the disabled, for a long time, the disabled people had called for the abolishment of a grade system evaluating the severity of disability, giving grades or ratings for the level of disability was a major complaint among the disabled community. So you can say that this is a major accomplishment during the Moon Jae-in administration. And also a number of efforts have been made to deal with the challenges faced with the disabled. And also we could see the expansion of the government's role in social services. I'm sure that my next speaker will emphasize this. But when it comes to social services and caregiving, these services have entered into the public realm, and I think that the government really clearly delivered that message that the public sector is willing to step up. That is a positive point of the efforts that were put into this area. So, since there was input, of course, you can say that there has been changes following such input and policies. If you compare 2016 and 2021, you can see that the overall budget increased by 171 trillion, and you can see that there was a 4.0 percentage point increase in terms of the percentage of the budget for welfare and health against the total budget. So you can see that from 122 trillion to 199 trillion, there was an increase. Just because there's input, it doesn't necessarily mean that there is output, but at least with a minimum input. Just because there is input doesn't mean that there is no output, but in order to have output, you have to have input. So this incumbent administration should be evaluated in a positive light for having made efforts to increase the input. And in terms of the social expenditure as a percentage of GDP announced by OECD, you can see that Korea is shown in red. So among the OECD countries, Korea is the fourth country at the bottom of the list when it comes to social expenditure as a percentage of GDP, and so there has to be further efforts to increase the social expenditure. So I've talked about some of the accomplishments, but also outcomes. And it might seem that there were only good parts about the policies implemented by the current administration. I do believe that it is positive that important messages and signals were given through the policies that were implemented. But also it is important for the people to really vividly feel the changes that have been driven by these policies. But I'm skeptic about whether such efforts or investments were really felt by the people. And why is it so? Well, I believe that as structures are changing, there are changes ensuing, but there has to be more bold restructuring in our society. For example, there are some blind spots that have not been covered. And also the labor market structure is changing. And this has led to some people losing their jobs and having to find jobs again. But although there was more investment to help the vulnerable in our society, these people who continuously lose their jobs and have to seek re-employment are not benefiting. So maybe that is why the full impact of the efforts are not felt by the overall people. I think that the greatest outcome of these efforts would be the happiness of the Korean people. But you can say that overall, in general, the Korean people are not that happy. So this is an index that shows the happiness level of each country. And if you look at Korea's position, well, if you look at the graph on the right, there is a graph, and so there is a standard deviation, which is the x-axis for the control ladder. So right now, the absolute level of happiness is quite low in the Korean society, and there is even inequality in terms of happiness. The gap among the people in terms of happiness is widening. In order to create a better, inclusive society, the first major challenge would be to have the people feel the changes and to enable the people to be more happy. That should be the focus of the social policies. So there were a number of policies implemented, and there are outcomes that are shown in figures, but they have to be linked to the level of happiness of the people, and I think that is a remaining challenge for this administration. Last but not least, when we set the direction for an inclusive society, and this is something that has been emphasized by many researchers, not just expanding the social welfare, but at the same time, there has to be a balance between innovation and welfare and inclusion. So as you can see here, Korea, well, is at the middle level when it comes to innovation. And when it comes to social security, we are lagging behind many countries. So not only expanding social security, but also we have to enhance the level of innovation and strike a balance. And that would be the way forward for Korea to emerge as an even better inclusive welfare society. And also there has to be more financial support given to children and women from a social investment perspective. And also we need a new family structure so that we can tackle the social challenges that we are faced with. And that would help Korea grow into a more sophisticated welfare state. Thank you very much. Yes, thank you very much, Dr. Cho Sung-eun, for your presentation. And now, let us go into the last presentation.
The last presentation will be by Professor Kim Hyung-yong of Dongguk University. He will present under the topic of Public Care, Establishing Community Trust. Please welcome him with a big round of applause. Good afternoon. As have been introduced, I am Kim Hyung-yong of Dongguk University. Today I would like to present under the topic of public care. Well, the actual academic term is social services. But when we talk about social services, the elected officials of local governments and the bureaucrats of the local governments, the policymakers and the public, they don't really know about social services. And so we need to use a new word that is more familiar, and that is why we use the term public care these days. The reason why we talk about public care is because we are discussing the achievements of the Moon Jae-in administration, and this concept is not shared in order to highlight the performance of the Moon Jae-in administration. But there has been a fragmentation in the path for public care. The social services that started in the Nomuyeon administration was focused on creating jobs and creating employment. So social services need to contribute to creating jobs. And so we believe that we can invest in social services in order to enhance the creation of jobs. And then the two subsequent governments following the Nomuyeon administration talked about high added value social services, high potential social services, and they were focused on creating jobs as well. And then centered around the Ministry of Labor, there was social work that was created and also jobs for the vulnerable groups. And so social services were focused on job creation for the vulnerable groups. So that was the policy direction. But with the Moon Jae-in administration, it seems that we have a new direction because we are focusing on the fact that social services is a part of Social Security, and it is a part of the government responsibility to provide public care to those who need it. And so that is why we talked about 810,000 work jobs in the social sector. 334,000 of them are new jobs for public care. And so we have announced that we need to start the new paradigm of public care. And that is why we have started our policy of Social Services 1. And so that is why I would like to take this opportunity to talk about the background, the process, the current situation, and how we're going to develop public care in the future. And we have just heard from Dr. Cho, and so just like he mentioned, we are not at a stage where we can evaluate these policies yet. So let's take a look at the environment for care, and then the New Deal for public care, and what can the government do, what can the nation do for public care. And so there are three parts that I would like to speak up during my presentation. Well, just like Professor Im has mentioned, as you're well aware, public care is at a very difficult situation because of aging. The aging population in itself is not a problem, but in Korea, we see that the percentage of the elderly who are not healthy is increasing compared to Scandinavian countries, for example. We don't have enough healthy people who are elderly. We actually have only 64 years in our healthy life expectancy. And we see that in the OECD countries, an average of 44% among the elderly are healthy, but we actually have that percentage that is very low. So who is going to shoulder the burden of care? We believe that the society should shoulder that care along with the individuals, but that is not true in the reality that we live in. We see that long-term care provided by the public is much lower in Korea compared to OECD average, and there is less support for long-term care compared to other OECD countries. We see that there is a large investment for healthcare, but if we take a look at long-term care or other services for the elderly, just like Professor Lim mentioned, it is centered around hospitals, especially the hospitals for long-term care. And so, it's very difficult to say that these systems are sustainable. So we're not just going to take a look at the elderly. There are different types of public care that is needed. In the past, we only provided public care to those who are vulnerable, and then we increased the coverage, for example, to home care. But now, because of the aging of our society and also the various types of care that is needed, we are responding by adding services. So from the 50s until now, has the nation continued to provide public care, whether it be for children, for the elderly, or for people with disabilities? It was mostly provided by social entities. But after we started to have universal care, we see that individuals provide that care with the financial support of the government. And so, what are the services that are being provided by the government currently? There are tens of thousands of different services, and they all have different names, and they have different budgets, and they have different delivery systems. And many of these services are based on vouchers and cash. Other services such as childcare, home care services for adults are mostly centered around using cash in the delivery system. And so what happens? During times such as COVID-19, when there are external shocks, then private care starts to become deconstructed, and there are blind spots. During the early stages of COVID-19, we have had many of the homes for the elderly or homes for the disabled who have large number of confirmed cases. And because of this situation, private organizations and private individuals will provide that service. And if we have childcare at home, because the care is done by the private sector, we see that there are many blind spots, especially during situations of COVID-19. In the process of increasing public care in a very rapid way, we have utilized private companies, and these private companies start to become in competition with one another. That actually decreases the level of the labor that is provided. And we also see that rather than there being a relationship between the user and the provider, they are each looking to have their own benefits. For example, sometimes if we just pay taxes and if care is provided by the public sector alone, then it will not be sustainable. But we have tried to cover such care using the social insurances. According to the Social Security Act, social services are included in Social Security, and one of the social services is care. And so, care should be provided by the local government and the central government, and we need to take a look at the role that they will play in these systems. But our definitions and systems are very ambiguous, and the delivery system is also very ambiguous. You're not sure if the budget is coming from the central government, the local government, or social insurances. And so when there is such ambiguity, it's very difficult to guarantee the right to care for the people of Korea. So, the Moon Jae-in administration focused on shifting to public care, moving away from care provided by the private sector with the budgetary support of the government. So let's take a look at some of the issues for public care. First, what is public care? We need to take a look at the definition. For example, when we have care for the elderly, care for children, care for people with disabilities, we believe that that is a responsibility of the government and the local autonomies, but who should be responsible for such care? That is not clear. The roles and responsibilities have not been divided clearly. And so we're not sure if this is the responsibility of the central government or the local autonomies. And so the right to care should be institutionalized by having an accurate delegation of roles and responsibilities. The current administration has worked with the central government and the local government to conduct various dialogues on the roles and responsibilities. It seems that there is actually a consensus finally. So the local government should be in charge of public care, and that is why we have come up with the concept of community care. And we need to make sure that we have communities centered around the actual local communities. And when we talk about public care, it should be a platform with the participation of the community. The infrastructure should not be a responsibility of just the nation and the local governments, because then the mutual care for one another within the community can become deconstructed. And so we need to have a platform with the participation of the community. And so the Ministry of Health and Welfare is working on developing these infrastructures. And so the market players, the social players, the community players should participate in this public platform. That is the direction of the Moon Jae-in administration. So I talked about the ambiguity. So in using public security allowances, the laws state the beneficiaries, and the laws state that the beneficiaries have the right to the actual process itself. But in this administration, there was the empowerment of the local communities and the local autonomies to provide public care through the local government and local communities. And in that process, we need to mention that we needed investment for infrastructure. Investment into infrastructure means that we need space to take care of people, and we also need the manpower to provide care. And so, in the initial stages, we talked about having 340 public hospitals for long-term care, as well as public daycare centers. What about the increase in manpower? You can see that based on the plan to increase the infrastructure, for example, adding 340 public hospitals for long-term care, that means that we will also be adding manpower to run these facilities. In Seoul, Daegu, Gyeonggi, and Gyeongnam, the four areas where the initial projects were started, we have added 11,200 people as additional manpower. And if we can expand this on this scale across the country, we believe that the public infrastructure will be quite meaningful. And that was the plan in 2017. But the relevant laws were not passed, and we had the resistance from the private sector, and there was also the lack of agreement amongst public service providers. And these test projects, they are not showing a lot of performance. Well, there is a typo. 355 is a typo for Seoul. We can see that there is less than 10% of the manpower that was increased against the actual plans. I think the number in Seoul is quite meaningless, but the number in Daegu, Gyeongnam, and Gyeonggi actually had an increase of about 50 people each. The public daycare centers, we can see that about 100 people were added for each metropolitan area, which is quite insignificant. And we see that if we take a look at the labor environment, in Seoul, there has been slight increases and improvements, but in other areas, the environment in which the caregivers are working has not improved. And so we don't have adequate investments by the local communities. In Seoul, we have had 25 billion won in investment, but in the remainder of the regions, their total amount is about 30 billion won. And so there's not a significant amount of investment in the infrastructure, and therefore we do not have a significant shift to public care. So who will make the necessary investments? Well, in the future, in order to overcome these limitations, we will need to empower the local communities, but we will see that the local communities and the local autonomies will not have enough budget to make the investment. And so, although we empower the local autonomies, we will still need the funding of the central government, and that should be the New Deal. And so, we need to make sure that the funding comes from the central government. If the local governments come up with a plan, the financing should come from the central government in order to make sure that we have an expansion of public infrastructure for care. From now, I would like to take a look at why we need to focus on public care. Well, in a nutshell, when we talk about an inclusive nation, an innovative nation, a welfare nation, it cannot be left up to the market. As a modern welfare state is, we need to create a public goods. We need to make sure that we have public goods and common wealth. As you're well aware, whether we take a look at wealth, whether we take a look at GDP, most is owned by the private sector. And when we talk about different services, we always talk about the participation of the private sector through non-profit organizations, but the non-profit organizations do not have a large budget. And so, if we take a look at the GDP, the government budget, and the welfare budget is less than 10% of the total GDP, and only 2% of that comes from the private sector. And so, if we actually have participation from third parties, we can see that the additional budget that can be secured is only 2 to 3 trillion won. And so, if we are to provide public care, it should come from public budget. And if we are to use a public budget, then it cannot be so large to become a lion's share of the total government budget. And so we need to utilize the assets that are owned by the private sector, and we need to make sure that this is led by the public sector. And in order to do that, we need to build trust on the public side. So in order to create common wealth, it means that the people, the enterprises, and the providers and the users, they all have a common goal and work together in order to create common wealth. And that can only happen when there is trust building. When there is trust, it means that on the institutional side, we need to be reciprocal and we need to have compensation for when compensation is needed. And so the current system is overly focused on the private sector and on profits, and this should be kept in check. And for the areas that go beyond the social norms, we need to be able to restrict that, and that actually is not happening for public care currently. Another point is, what about the blind spots in the market? The public should take care of the blind spots, but does the public actually have that trust? We need to make sure that we have the manpower and infrastructure that can win the trust for the public side. So we need to have government officials that have expertise in social services. And when we have such experts in the government, then they can become a focal point in bringing together the private sector, the public sector, and the non-formal sector to bring about public care. And so we need to start from the public sector, and entrance barriers should also be managed by the public sector. Many of the facilities that are managed by the private sector actually are thought to be a public good, but it is only being used by a few. And it is very difficult to guarantee the public good of these institutions. So in order to make sure that we have public care and to actually have experts in the public sector related to social services, we need to make sure that we guarantee the quality of services and also the environment for the manpower to work in these services. So currently, care is something that is traded based on monetary value. So we need to make sure that we focus on the right to care. And when we do so, we can reduce the blind spots for public care in this era of aging population, and we could have a better vision for public care in the future. So we need to make sure that we rebuild trust for the public sector. Thank you very much.
Yes, thank you very much. And let us now go into the panel discussion. So we had 3 speakers, and there will be a moderator for the panel discussion who will be President Lee Tae-soo of the Korea Institute for Health and Social Affairs. I would like to invite all the speakers, the moderator, and the discussants to come up on stage. Professor Yoon Jang-ho, as well as Dr. Bruno Ballier, and also Dr. William Andema. They will be joining us online as they are overseas. The moderator, as mentioned, is President Lee Tae-soo. Let me briefly introduce his bio. He is currently the president of the Korea Institute for Health and Social Affairs. He is also a member of the Presidential Committee for Social Affairs. Let's invite them all.
소개받은 보건사회연구원의 이태수 원장이라고 합니다. 아시다시피 두 번째 세션은 포용사회 그리고 복지를 확장한 문재인 정부 이런 타이틀이 걸려있는 세션입니다. 아까 발제에서도 나왔습니다마는 문재인 정부가 출범한 2017년 발표된 국정 운영 계획상에 100개의 국정 과제가 있었을 때 그중에 32개의
policy task announcement, and there were 100 policy tasks included, and one of them emphasized the inclusive society. And after a year, the government declared to achieve an inclusive society, and new social policies were announced. So the Moon Jae-in administration has been actively establishing plans and carrying out activities for creating an inclusive welfare country. And also, since then, there has been evaluations about the efforts made, and there is continuous debate about the policies and the efforts made. So 4 years have passed since the inauguration of the Moon Jae-in administration, and we are here to evaluate some of the outcomes. As you have heard, the Moon Jae-in administration has put into place a number of policies. And one of the leading so-called brand of this is the Moon Jae-in Care. And this was implemented to create a welfare country. Also, social security was pursued, and also public security, social welfare services were mentioned by our speakers, including especially Dr. Cho Sung-eun. And also when it comes to public care, the Moon Jae-in administration has made much efforts to put the care services or the social services into the public arena. And Professor Kim Hyung-yong talked about some of the future-oriented directions that should be taken into consideration. And now we will begin the panel discussion. We have 4 discussants that we have invited, as you well know. Globalization has been weakened because of COVID-19. But if you look at the international conferences and seminars, we can see further promotion of globalization because, as you can see, our panelists, well, 3 out of 4 are located across the globe, at the opposite side of the globe. And I understand that Professor Yoon Jang-ho is in Maryland of the United States. So it's about 3 o'clock in the morning, is that correct? So he's still up late in the night because he has to join us. Professor Yoon Jang-ho, would you like to say hello? I just introduced you, but please go ahead.
안녕하세요. 반갑습니다.
네. 새벽 3시인 거는 맞나요?
Is it 3:30 right now? Is that correct?
네, 3시 38분.
Yes, it's 3:38. Yes, it's almost 4 in the morning.
그리고 이제 두 분은 제가
And then our other 2 panel discussants are in Paris, France, is that correct? So first of all, from Siang's Po, a well-known, renowned institute, Director Bruno Ballier is joining us. So Dr. Bruno Ballier is with us. Hello.
Hello. Hello, everybody. Thanks for having me with you.
Yes, so I understand it's about 9 o'clock in the morning.
Yes, it is. Yes, exactly.
And last but not least, from the OECD, who has been working on SACS, social expenditure, for a long time and analyzed such matters. Very knowledgeable in terms of social policies. I met him 25 years ago in Paris, but nevertheless still he is with the OECD, very active in research of social policies. Dr. Willem Adema, thank you for joining us.
Thank you for having me, and it's a pleasure to be at the conference. I always learn a lot when I listen to Korean speakers, because there's a lot going on in your country, and this morning was no different. Very interesting presentations, and I would like to thank the interpreters for being there, because otherwise I wouldn't have gotten anything of it. So thank you very much.
Yes, thank you. And so I will give you opportunities to speak. And one discussant is from the Korea Institute for Health and Social Affairs. He has engaged in many research about the welfare state and income security. He's a senior research fellow at our institute. Dr. No Dae-myung, thank you for joining us. Yes, thank you for inviting me. I was able to learn a lot from the presentations, and I hope that my comments can contribute to an active discussion. Thank you. So there's a panel discussant who's up in the middle of the night. But we only have about 40 minutes remaining, so please bear with us. And I think I will be able to allocate only a couple of minutes. I was planning to give 10 minutes, but I would like to ask you to keep your comments as short as possible. I don't think it would be right to ask those in the US and France to cut their remarks. I apologize for the time constraints. Professor Yoon Jang-ho, could you please begin? Professor Yoon Jang-ho, I think, will comment on the presentation by Professor Im Jun related to the Jae-in care. So please go ahead.
Hello, everyone. I'm very pleased to be here to comment on the important topics Dr. Im has covered. I'll try to make it really brief. So touching briefly on some complementary points that may serve as additional guidance for healthcare reinforcing efforts in Korea. The very first point I'd like to make is about healthcare delivery system. So patient-centered, I believe patient-centered value-based care, it should be adopted as an integral part of the healthcare delivery system in order to address the changing disease profile in the Korean population. I believe modern integrated care delivery models, such as enhanced patient-centered medical homes and counter care models, which emphasize disease prevention, primary care, and care coordination, may serve as patient-centered and value-oriented alternatives to the fragmented care delivery system in response to the changing disease composition in the Korean population. So here in the United States, we have seen a proliferation of these delivery models because they offer plausible mechanisms for achieving the triple aim of the healthcare system, which is better health, better care, and lower cost. The second is about the value of public healthcare services. So a market-driven healthcare system could be very fragile, resulting in so-called market failure. And we know that market failure would affect individuals and families in low-income social minority groups the most. So therefore, providing public healthcare services could be an effective way to address the existing healthcare disparities and health inequalities. In the United States, with some exaggeration, 3 in 4 US hospitals provide some sort of services for public benefits addressing community needs. And historically, public hospitals in the US have played an important role in the healthcare safety net. Likewise, community health centers have also played an integral role as the nation's healthcare system for more than 50 years. And there is evidence that public healthcare yields positive return on investment. So therefore, I think public healthcare for low-income social minorities and residents outside the major metropolitan areas in Korea, especially the capital region, may not just make a political sense, but it may also be an economically prudent choice. However, we shouldn't downplay the fact that the market-based healthcare system allows for greater efficiency and improved consumer choice than a regulated system. So in fact, in the United States, inefficiency inherent in the public healthcare sector led to gradual decreases in public hospitals in past decades. Among others, providing quality ambulatory specialty care has been a challenge for many public hospitals. So I believe the public healthcare system should be an essential component of the overall healthcare system, but simply adding more public hospitals or clinics, for example, is a mistake because of their known inefficiency. Instead, we also should address the efficient financing and planning of the public healthcare and the shortage of the healthcare workforce simultaneously, capitalizing on efficiency that market-driven healthcare could provide. I think the current innovations across the United States may provide some additional insights for Korea. The third is regarding health insurance coverage coverage expansion under Moon Jae-in care. So it is encouraging to find the expansion of health insurance benefits under Moon Jae-in care overall has effectively reduced household health expenditures, reducing household healthcare cost burden. But the coverage expansion has also been accompanied by the balloon effect of non-covered services. Unfortunately, Moon Jae-in care's strategies to addressing the balloon effect do not seem to produce desirable outcomes yet, and I can see the need for systematic management of non-covered services. The last point I'd like to make, but not the least important, is we should think beyond medical care alone. So it is my observation that healthcare is still being narrowly perceived and discussed under the clinical care-centered paradigm. And I believe it's time to start thinking beyond just healthcare in all healthcare policy discussions, and because of the importance of other determinants of population in individual health. In the United States, healthcare systems of all kinds are currently moving beyond clinical care alone to connect patients to resources that support food access, housing, employment, transportation, and so on, other social determinants of health. So to conclude, I believe the Korean healthcare system was able to go one step further during the past several years. However, it still has many difficult challenges, including A, instituting a paradigm shift toward patient-centered, value-based care, B, providing public healthcare services, capitalizing on market efficiency, C, developing policy leverages to address unintended consequences of health insurance coverage expansion, and D, thinking beyond clinical care alone in health policy and planning. I believe continued effort to address these important challenges will help further elevate the Korean healthcare system in years to come. Thank you very much for your attention and this opportunity to comment.
네, 감사합니다.
Thank you very much. You are late in the night, but thank you very much for sharing with us these very adequate and eloquent points. Well, I believe that Professor Lim, the Moon Jae-in care that you presented, you probably have ideas about the lack of efficiency in public hospitals and public health care, and the balloon effect following the enhanced coverage. I'm sure that you probably do have comments that you would like to make concerning the points made by Professor Yoon. And so we will go back to you after all of the discussions. Next, we would like to invite Professor Pellier for his comments. Your comments, please.
Yes, hello. So I hope that you can hear me well. Once again, thank you very much for inviting me. I'm really pleased to hear about all the changes in social policies that have been implemented during the current mandate. I will have three types of remarks. The first one is to emphasize the turning points made under the Jae-in administration. The second one is a series of questions related to the connections of the welfare state to family and labor market. And finally, I'd like to come back on the social investment and social investment policies in Korea. So the first point is I'd like to underline how much big changes this administration has implemented within the traditional approach to social policy. I've been connecting to South Korea for years now, and I'm really amazed to state that there has been a big shift. The first rupture, to my view, is the rupture with the limitation in public spending. When I came to Korea years ago, I was saying, I mean, you could spend more on social investment for pension. And the answer was always, but there is no money. And I was always amazed because Korea had one of the lowest public spending in the OECD countries. So there has been a big change here. And it's noticeable that it seems that the political limit to public spending has been overcome. And that's a big news. One question that comes from this is whether Korea is moving its own growth model. You know that growth model is something which is discussed currently in the comparative political economy, and you have some countries which are focusing on exports to provide growth to their country, and others who are focusing on domestic demand. And Korea was, of course, traditionally perceived as a typical exporter country, focusing a lot on its productivity in the exporting sector, limiting public spending, limiting wage increase in order to be competitive in the world market. Does the increase in public spending mean that Korea is adding a kind of second pillar to its growth model with domestic demand? It seems to me that this was the case when I came to Korea 3.5 years ago, but this is it clear here, and is it something that is made explicit by the governments and by economists? The second rupture I see is the rupture in the type of policies implemented. Most of the economic and social policies were focused on investment and not so much on redistribution and compensation, neither on social services. And what we've heard today, what we've seen happening in Korea over the last years is an increase in compensatory spending, so more spending on pension, partly on unemployment insurance. And this slight increase in spending in pension is absolutely necessary for the elderly, but also for the outsiders, who are, as we all know, numerous in Korea. There is a lot of low-skilled people. There is a lot of independent workers who are relatively precarious and have relatively low income. The development of social services, especially for the elderly care, is of course very necessary in such an aging society. But we have discussed already, and my predecessor in discussion has underlined the difficulties, especially connected with the private sector involvement in there. The third rupture is also a strong rupture, apparent at least, in the traditional familialization. Korea was well known to rely a lot on family, and especially on women, to take care of children, to take care of the elderly. And there was even legislation stating that children should take care of their parents if they have difficulties before the welfare states come in. I will come back on that. So these are big rupture. We can speak about a paradigm shift, but I was struck by one of the presenters saying that people don't really feel this shift in paradigm. And I would like to have three questions related to this perhaps absence of feelings. These are questions related to the connection of these changes in policies with the families and with the labor market. You know, in the welfare state literature, we use the welfare triangle. You know, we know that what people can count on come from the labor market, come from the family, and come from the state. We spoke a lot about the state today, but I wonder whether people perceive and implement changes in their family life and on the labor market. So the first question is defamiliarization complete in Korea, especially towards the elderly? I've read the short text you've sent to us in advance, and there are less and less conditions for the families to take care of their parents or their children as far as housing is concerned, as far as unemployment is concerned. But it is not clear to me whether the same removal of the conditions are made for pension. It wasn't clear for me whether before receiving a pension, and especially a minimum pension, there is no obligation anymore for children to guarantee that they cannot help their parents. And as we know, this was a very, very critical measure which explains a lot, not only the poverty of the elderly, but the misery of the elderly who wouldn't dare to ask their children, but therefore couldn't ask the welfare state to support them. We've seen some data about the minimum pension given to the elderly, and it seems to me that it hasn't increased so much. And it seems to me that there is still familiarization here. There is still the assumption that the children should take care of their parents. And this is a problem, a moral problem, as you know about the suicide rate of the elderly in Korea. But this is also a demographic problem. If you have less and less children, and still the society continues to expect the children to take care of their parents, of course, their parents, and for parents, if you think of a couple, it becomes extremely complicated. So I think that the trend towards defamiliarization of welfare should be continued. Then comes the question about the changes in the labor market. I guess that's one of the reasons why people don't feel the progress has been mentioned already. There is still unemployment. There is still a lot of jobs who disappear, and the state may not be totally able to compensate for that. So are social policies sufficiently targeted at the biggest losers of the labor market? We know that the Korean labor market is extremely dualized between insiders working for the public administration and for chaebols, and there is a huge chunk of the labor market which is working either in small firms, small companies, small shops, or are independent workers, even sometimes in the informal labor market. These many outsiders, are they seeing their situation improving on the labor market? It doesn't seem to be the case if we look at the Gini coefficient that has been given about primary income. But do they see the welfare state? You know, and I'm not sure that there has been improvement in access to services, healthcare, job placement agencies, etc., for these outsiders. So there is still an issue, and this may be absolutely key to improve the situation of the labor market, to decrease or de-dualize the labor market if you want the people to appreciate the big changes implemented in the social policies. The third point is about gender equality. I didn't hear about it. You know, there was no presentation about that, but we know that the Korean society is extremely unequal as far as gender is concerned. And I cannot avoid to say that we are only men in the panel today, at least the one I'm attending. And I'm a bit surprised. I must say that I know really excellent female researchers in Korea. I can quote, for instance, Sophia Lee. And I think that at any places of society, we should make effort to promote women. This would probably lead to improvement concerning fertility, concerning labor market improvement, concerning the big issues. And it might be that gender equality hasn't been really part of the paradigm shift that I was referring to. Finally, I'd like to speak a little bit in the few minutes I have left of social investment. As you know, social investment has been a key word in many, especially progressive presidents since the last 15 to 20 years in Korea. And we know that social investment is a series of social policies aimed at human capital creation, but also human capital mobilization, improve the participation in the labor market, and preservation. And traditionally, Korea has thought of social investment as a way to improve both the situation in the labor market, improve participation rate in the labor market, especially of women, and hoping that this would have some positive impact on fertility. We haven't seen that. We haven't seen the progress of participation of women into the labor market, at least as on par with men. Neither have we seen increasing fertility. And one question here is that it may be that the social investment is not totally social. The part of education remains partly occupied by private complement. We know that the cost of education appears very high for middle-class couples in Korea, and this is probably one of the reasons for them to keep to one child. And since you're questioning the role of the private sector in care, you may also question the role of the private sector in education. And more broadly, you may also question the very elitist educational system, which feeds the dualization of the labor market. You know, people go to one or two or three highly expensive, highly selective universities in order to have a very good, well-protected job in chaebols, but the rest of society is left aside of this virtuous situation. This is not what we need in a knowledge-based economy. In a knowledge-based economy, we don't need only an elite to be educated and the rest to be left outside and as outsiders. We need a much more inclusive, not only welfare, but inclusive social investment and inclusive educational system so that the overall level of education of the population and the productive capacity of the whole workforce is improved, including those of young people, elderly people, and women who should have as many chances on the labor market as their husband. Thank you very much for your attention.
네, 감사합니다.
Thank you very much. Indeed, you are very knowledgeable about the Korean situation through your exchanges and interest, and you have participated in various researches. And so that is why you were able to provide us with very detailed questions, and you were able to name the numbers of elitist educational organizations in Korea. So you are very knowledgeable about the Korean situation. Thank you very much for your detailed questions. Most of the questions were related to the presentation by Professor Cho, but I am sure we do not have enough time to answer all of these questions. We will have to be up all nights of the hour in Korea in order to answer these questions. So I think you will need to have a separate exchange between Dr. Cho and Dr. Pellier so that the two can exchange in their own time. You talked about women participation, the fact that we do not have any ladies on this panel. Well, I actually noticed that as well before you pointed that out. Well, it was not intentional, definitely. But as a result, we have no ladies on this panel, which is quite unfortunate.
Let us go on to our third discussant, Dr. Adema. Please go ahead.
Thank you, Professor Tensholi. You're right. The color of our hair has changed since our first meeting. But you seem to be doing better than I am in this regard. The great thing about Bruno Pollier's intervention is that he mentioned many things I was going to mention. The good thing is, therefore, that I can try and keep it short. But the message for the audience might be that there might be an element of truth in what we're saying. Let me first say a few things about social expenditure, because the changes in Korea have actually been important, and especially in international comparison. If you look back at the early 90s, social spending in Korea was 2.5% GDP. This includes health. That has increased fourfold. So that's a huge increase. And there is a study by Kihasa, a 2014 study, which projects Korea to go up to 22% of GDP in future, just above Canada, but below the range of OECD countries with projected social spending between 30 and 40% of GDP. Now, most of this increase is aging related, i.e. increased spending in pensions, which in Korea has increased threefold since the early 90s. Health expenditure has also increased fourfold since the early 90s, but the biggest increase in relative terms has been on family spending and on the development of a public childcare system. In between 2000, the early 2000s and 2018, spending on family benefits increased tenfold. 0.1% of GDP in the early 2000s, 1.1% nowadays. So that's a dramatic change, and it's an illustration of what Korea can do when society puts their mind to it. And it's very rare to see such an expansion in other OECD countries in such a short period of time. Now, the Professor Cho, I pronounce his name correctly, has pointed out the recent important changes. I was particularly struck by the increase in the number of people covered by the national livelihood system in recent years. So that represents an important change. The other important change, particularly when it comes to inclusive welfare, to inclusive growth, is greater accessibility of maternity leave and parental leave benefits. That expansion is not complete yet, but sorry about that. It reflects a key characteristic of an inclusive welfare state by trying to get more people, keeping more people in the labor market and in societal participation more generally. And this is an important point which I think various speakers have alluded to. The government cannot do it alone. We can make welfare reform. Public policy has an important role to play in this, but workplaces and families and individuals themselves have to pick up a very important role. Public policy can continue to stimulate investment in family services, for example. In comparison to most OECD countries, child allowances are low and they stop at age 7 when kids go to school, whereas in most OECD countries they continue until adulthood. The other issue, which is an issue which is coming up in many OECD countries, is the cost of housing. Public intervention can help invest in more affordable housing, or can intervene by keeping rents in check. So the government can play a role in that area. But what is very important is that public policy is consistent, is reliable, and generates trust. And that word I heard various times this morning. But it is very important that the populace in general can feels that it can rely on public policy, that it will be consistent, and that it will be there in 10 years' time, because that's the kind of trust you need in order to re-establish an increase in the fertility rate, for example. To that end, it's not just public investment, it's workplaces. Dualism, as Bruno Payet has already alluded to, causes many problems in terms of certainty, employment security, precarity. The gender issue is important. We at the OECD are normally not allowed to participate in panels anymore, i.e. panels which are only which only include men. Now I can claim that my Korean wasn't good enough to realize that there were no women on the panel. But it is a sign of the times. You have to make optimal use of all the talent in your society. And gender equality is an important element in this regard. It is also an important element, not just for workplaces where discrimination still exists, where women, although it's getting better and uptake of maternity and parental leave is increasing, still often leave the regular labor force to have children, if they do, or they don't at all. Men should be allowed to take their parental leave, to which regular workers have access, for a year long. That is incredibly long in comparison to all other OECD countries except for Japan. But many men, of course, do not take this because they fear the career consequences. So the workplace has to become more conducive to parents taking their care at home responsibilities serious. And that's the other thing, gender equality, dare to share at home. Korea is one of the countries with the biggest gender differences in unpaid care and work at home, time spent in unpaid work at home. And that might be changing. The younger generation might be having a different approach than the elderly, but still, the labor market institutions still expect full-time, long hours commitment, particularly of men, but also of women if they wish to pursue a regular career pattern. And that is not compatible with having a family life. Then the key challenge for Korea is, and Bruno has also pointed to this, is to reduce the cost in time and money of education. It's inconceivable that the fertility rate will be rebounding if that issue is not addressed in a comprehensive manner. And policy can help by generating trust and giving Koreans the feeling that yes, they can marry, yes, they can have 2 children or 3 children. The system will help them, and the demands on their time will not be impossible. But it's not just a public sector job, it is also a workplace job and a family and behavior at home job. I thank you very much for letting me make this intervention, and I am looking forward to the rest of the discussion. Thank you.
네, 고맙습니다.
Yes, thank you very much.
아데마 박사 역시
So Dr. Adema,
분석을 오랫동안
once
해왔기
again,
때문에
well, he has for a long time engaged in analysis of Korea. So he looked at the social expenditure statistics and talked about the changes throughout the years and also the policy changes as well. But ultimately, he talked about the policy changes required for Korea. For example, he talked about building the trust through policy changes so that, for example, in terms of childcare or the birth rate, he talked about what is needed. So I think that rather than raising a question, he made a number of invaluable comments.
말씀하실 부분이 있으면 이 부분에 대해서 간단히
And so I think that in relation to Dr. Adema's comments, if the speakers have something to say, please go ahead and let me invite the last discussant, Dr. No Dae-myung.
네, 안녕하세요. 벌써 시간이 다
Good evening. I think time is almost up, and so I'm going to try and save as much time as possible. We are here under the topic of inclusive recovery and a leap forward. And I believe that's probably the slogan for the overall social policies of the Moon Jae-in administration. We are looking to foster creative talent, and we are also trying to create conditions for vibrant labor in the market so that we can protect the vulnerable groups. That is the vision set forward by the Moon Jae-in administration. Related to this, I think various comments would be possible. But we can say for sure that much effort has been made. Of course, there are different evaluations on the outcome. Professor Kim Hyung-yung talked about public care, and the care sector is the area where the Moon Jae-in administration was the most ambitious with the grandest vision, but there is still a long way to go. Just like Professor Kim has mentioned, the care policies of Korea were centered around the private sector, but we have changed the direction to public care. That directional change was absolutely necessary. But enabling this change calls for various delivery systems and policies and funding mechanisms. Such a change is inevitable at this point in time. As Professor Pellier has mentioned in his questions, the Korean society is not a society where the working age population can support the elderly population. Half of the elderly population are not being provided with private care, and there is vulnerabilities in terms of income. And so, the current system of where the working age children are taking care of the parents, that system is being ruptured, as Dr. Pellier has mentioned. And so that is a crisis on our hands. And so the private care system is no longer sustainable given the demographical pattern. And so we need public care in this situation. Professor Kim mentioned various aspects and the ambiguity of the definition of social services and the reform of the relevant laws based on a more accurate definition is absolutely necessary. We have a large portfolio of services, but it seems that we do not have adequate investment into the necessary services and infrastructures. I would like to make this point. The Korean society is faced with a double shock, unlike Europe. First, we need to make sure that because we were not able to timely reform the income system for the elderly, we are faced with poverty amongst the elderly. And at the same time, we were not able to come up with an adequate solution for the care needs. And so we have a double shock of lack of income for the elderly and the lack of care for the elderly. Well, there has been issues of sustainability in financing for the European countries, and they are now at a point in time where they are thinking about how to solve the financial instabilities. But in Korea, we have to deal with both issues at the same time because of this double shock. And it will be very difficult to politically solve this issue in the next year. And so this will be the biggest issue at hand for the next government. Well, I don't have any issues that I would like to raise against the speaker, but there are 5 points that I would like to make. First, Professor Kim talked about the role of public care and how the public care should lead the private sector in providing care. Up until now, most of the policies for caregiving was focused on expanding the public sector, but the for-profit care providers already exist in our society to deal with them. Professor Kim has made a very meaningful suggestion that in expanding public care, it should be the public sector leading the private care providers. Of course, the government should continue to expand public facilities, but we also need to make sure that we take care of the private care providers that exist within the society. Up until now, they have been the mainstream in providing care. I think there are about 5 issues that we need to solve related to this. We need to first take a look at the role of the government. Professor Kim talked about the importance of the role of the government. Well, whether it be the direct expansion of public care or the expansion through the private sector, the government needs to manage the quality of the care and also come up with a system to guarantee the working conditions for the care providers. And so we need to have a standardized system. Second, in the process of expanding our services, there are issues that are arising. For example, in the past, we had a voucher system, and recently we have a more provider-centered system, and there are conflicts in the actual field, and so we need to come up with a way to coordinate these issues. The laborers need to be provided with adequate conditions and compensation, and for the users, they need to be provided with services that maintain their dignity. And related to the infrastructure of the government, we need to make sure that we have the government providing the adequate infrastructure. For example, expansion of care infrastructure. But the whole sector cannot be covered by the government, and we need to take a look at priorities. What I would like to suggest is that there are services that the private sector are not moving into, for example, remote areas or services for those with disabilities. And so public infrastructure investment should be expanded for these areas first. The 4th point that I would like to make is that just like Professor Kim has mentioned, community care and commonwealth is needed within the Korean society. We did have very ambitious tests of community services, but we have not had substantial results from these tests. So whether it be social services or community care, we need to make sure that there is coordination on the part of the government. Last but not least, for the care for the elderly, who will shoulder the cost? Within the presentation, we talked about hospitals for long-term care. Care services, including care for the elderly, needs to be provided through investment into infrastructure as well as investments into the manpower. And where are we going to find the financing for such infrastructure? We can utilize the health insurance system, but we also need to find additional ways of financing. Concerning this, I am sure that the government is making various considerations. This brings me to the end of my brief discussion. Thank you very much. Thank you. We thought that you would save us a lot of time, but you did not save us that much time. Thank you very much for mentioning the 5 points. And I think we can go back to Professor Kim later on if there are any comments to be made.
So we have completed all of the panel discussants making comments or questions, and now it is time for the speakers to reply. But please make your comments concise and to the point. The 3 speakers, based on what was mentioned by the panel discussants, please be sure to remember that as in the first session, we have been trying to reflect the views of the people, of the citizens of Korea, and we asked their opinions. For example, because of COVID-19, the Korean society has suffered, but please give your opinions on what is needed to improve our society. And there were 14 people who shared their opinions. They also raised questions as well. I don't think that we have enough time to share with you the comments raised, but I think that perhaps I can introduce 1 or 2 questions that were raised by the Korean citizens.
To Professor Im Jun, I have 2 questions. First, temporarily, there could be vaccine incentives to raise the rate of vaccination. So can such temporary incentives be provided across the country? So how are we going to work with temporary incentives for vaccination? Second, the expansion of nursing and care for the inpatients. So how can we strengthen the care and nursing services for those who are hospitalized? To Dr. Cho.
The question is not directly related to your presentation, but in the Korean society, I think the greatest challenge is the career path for youth and also giving them hope for the future. So the youth are concerned about their future. Are there any policies that can help them out? Well, I think that we can talk on and on for hours about this topic, but maybe you can emphasize just 1 or 2 points.
And to Professor Kim, because you spoke under the topic of care, we do not have any specific questions, but I think this is a question that you could address. In order to make sure that we guarantee happiness for the people, what would be essential? We would like to address this question to Professor Kim. So these are the questions that we collected from the public. And so please keep these questions in mind as you give answers within just 2 to 3 minutes, or possibly 3 to 4 minutes. We'll start with Professor Im Jun. Well, Related to strengthening public hospitals, how are we going to work with the inefficiencies? Well, I think rather than being a question, it was just pointed out that there could be inefficiencies. And I believe that that's a very valid point. In order to have efficient public hospitals, we need to work with the current public hospitals and take into consideration the low quality of services that are being provided compared to private hospitals, given the low amount of talent that they have. And so competitiveness is very important, especially better doctors and nurses for public hospitals. As our discussants have mentioned, being patient-centered is very important, and being value-centered is very important. And so I think the inefficiencies of public hospital is linked to being patient-centered and value-centered. How can we provide opportunities for patient participation? It's not just about making a choice, but rather enabling community participation in the operation of public hospitals, which will, I believe, help the inefficiencies of public hospitals. Second, related to Moon Care, you talked about the balloon effect. So the non-coverage treatment is very important in managing such non-coverage treatments. And because of the time constraint, I was not able to mention this, but in Korea, I believe that regulations of the private healthcare insurance is very important. And in Korea, that is actually weakening the public insurance. For example, the cost that should be shouldered by the individuals is then covered by the private insurances. And so I believe that that is currently a large issue. And so we need to take a look at how the private insurance can supplement public insurance without weakening public insurance systems. And so we need to take a look at the regulations for private insurance. And related to Moon Care, in order to block the balloon effect, we need to work on the overall delivery system. We need to take a look at how there is market-centered delivery system and profit-centered delivery systems in Korea. And we need to make sure that we emphasize the public aspect of healthcare in order to solve the balloon effect. Many people talked about vaccine incentives when we collected opinions from the public. Well, I think all of this is related to vaccines. Ever since I have become vaccinated, I felt quite a lot of pain. For the regular workers, they can take a day off when they are vaccinated, but for freelancers, for non-regular workers, it's very difficult for them to take a day off when they are vaccinated. And so the allowance for the ill and injured is very important. In the short term, related to COVID-19, if there are issues, we are fully covering treatment, and that is because of because we did not have vaccines. But when we are fully vaccinated, then we will have a part of the cost burdened by the individuals. And so I think an incentive for vaccines would be that even if you have been vaccinated, but even if you still need treatment because you become a confirmed case of COVID-19, then you will be provided with full care from the government instead of having a partial cost shouldered by the individual patient. In talking about nursing and care provided for the inpatients, well, we need to make sure that such systems are expanded across all hospitals for all patients. This is not easy because we need to have more nurses, and we also need to connect this with the roles and responsibilities of nurses and doctors. And so we need to make sure that we continue to add details to our policies so that this is possible. And there is a lot of burden for care at hospitals for long-term care. And so we need to make sure that we can connect the public care with the care needed for patients at the hospitals for long-term care. And so depending on the severity of the illness, sometimes you are sent home and sometimes you are sent to hospitals for long-term care. And so we need to make sure that various aspects such as the burden of care by the individual families is taken into consideration. For example, because the burden of care is so high at individual families, even if those who can be taken care of at home are sent to hospitals with long-term care. And so we need to make sure that we provide home care so that the policies are not concentrated on any one sector, but that we have a balanced distribution of support for various types of care, whether it be at facilities or at home. And so we need to take a look at how we're going to reorganize such cares. Thank you very much.
Thank you, Dr. Cho. Yes, Dr. Pellier raised many important questions and comments, but because of the time constraint, and I think that I can only make a few remarks. So first of all, in terms of public spending, and you talked about the change in the growth model, I think that this is something that I cannot touch upon. But as you know, Korea used to be an economy that was based on exports. But I think that that model that was dependent on low income is a very old model that we had in the past. We now focus on high added value, and we want to find the role that we can play within the global value chain. I think that that is a growth strategy for Korea. So having said that, the public spending, well, focuses also on fostering the human talents to create higher added value. And I think that public spending has that in mind as well, in my personal view. And also, this was mentioned by Professor No as well, but when it comes to the elderly, you asked about the reliance on family. And I think that, or de-familiarization, and I think that the dependency on children is rapidly declining, and a lot of the elderly, well, even before public transfer, of course it is true that there are elderly that are still dependent on their families, but I think that there is now a greater understanding and awareness that instead of relying on family members, they should be receiving the public support. And I think that that is a change that we can see recently, a rapid change in the sentiment of the people. And also with the start of the Moon Jae-in administration, minimum wage was highlighted as a major issue for the labor market, and that was a major agenda before the outbreak of the COVID-19. So there was a roadmap implemented to deal with the minimum wage, and employment services also are viewed to be important, and various employment services exist, but I think that now we're preparing to further diversify the employment services that can be provided. And it was mentioned by Professor Ballier and Professor Edema as well, the gender equality issue and the issue of the birth rate in Korea. I think that the low birth rate in Korea involves many different variables, so it's very difficult to define it and address it with just looking at a few factors. And the issue of gender equality is recognized as a very important agenda within the Moon Jae-in administration, and within the society I believe that much progress has been made in accomplishing gender equality, but by overly emphasizing gender equality, especially among the 20s, gender confrontation has risen as another very serious challenge in the Korean society. So Gender equality has been an issue that we've been worked on, but nevertheless, we are seeing continuous low birth rates. And I think that maybe that involves, in some sense, the traditional family culture and structure that we have. So the sentiment surrounding families in Korea is that the view that a family has to be lawfully organized. There should, for example, out of wedlock is very rare in Korea, relatively speaking. So marriage is like the basis for starting a family. And people believe that a normal birth is within a family, recognized by the law. That is a general sentiment within the Korean society. And so I think that in some sense, that has become a reason for people avoiding to get married. The marriage recognized by law is viewed to be normal in Korea, and many young people, therefore, are reluctant to go in that pathway. And that's why the low birth rate exists. People do not have children because they refuse to be lawfully married more and more. So I think that perhaps that's one of the reasons. Having said that, I'm not saying that people believe that families are bad, that people are moving away from that, but I think that we have to recognize the diversity and the different types of families. For example, we need change in our culture to embrace couples who are not married, for example. And also there was a question about the career path for the youth. I think that increasing quality jobs is needed. This is, of course, common sense. But aside from that, what I can say or propose from a policy perspective is that if you look at the European statistics, especially the northern European countries, there is a gap year between high school graduation and going on to university. So there is time given to the young people to search for their future career path. For example, in Denmark, about 86% of the young people enjoy a gap year about for 1 year to as much as 4 years. So they look back at themselves and they think about what is the right career for them. And I think that this is something that should be supported with policy measures, because compared to European countries, in Korea, the students, they really study hard for 12 years. They do not have time to enjoy leisure activities because they are so focused on their studies. And so they do not have time to look back at themselves or their desired career path. So they're very narrow-sighted. The young people, they do not have time to look back at themselves, the various diverse careers that exist around the world. So what do? They want to become public officials, and they go to these private academies that prepare them for the exams. So I think that it's not just about supporting income or supporting assets, but we need policies that can help the youth to really take time to look back at themselves and what is right for them to prepare for the future. I understand that perhaps there can be funding or funds to help the young people really look back at themselves. Thank you very much, Professor Jung. Professor Kim?
Well, I'm the last to go, so I will try to keep it as short as possible. Professor No talked about the overall social services system and talked about the market families as well as social jobs. And so he has made various comments, very appropriate based on his vast experience in research. As he has mentioned, the Moon Jae-in administration has been quite ambitious in changing the direction of public care. And so we worked on the delivery system, the financing, the manpower, and the conflict between the users and the providers. There were many challenges at hand. And so, just like we have heard, it's not just about adding one part of the social allowance or one part of basic services. Public care is not an issue that can be solved with one single solution because there are so many stakeholders and so many delivery systems. And so there is a whole chaos related to public care. Even within the same ministry, there are some different departments that have different interests. And so I believe that the next administration should continue this trend of the need for public care. So, as we have continued to mention, that is winning public trust. You need consistency in our policies. In one of the questions from the public, how can we create a happy society? Well, I always believe so, whether it be the user, the providers, or myself. If we have someone we can go to, if we can go to someone that we trust, that will add to our happiness. So it will not be about the users and the providers making their own opinions just from their interests, but we need someone that we can go to when we are able to trust that person. I hope the public sector could be that person that you can go to. Thank you very much.
Yes, we are way behind schedule, and so I think that we should wrap up. So I think that on numerous occasions we held these discussions to evaluate the endeavors by the Moon Jae-in administration. But I think that we need more diverse analysis and more in-depth and lively discussions to really look into what the Moon Jae-in administration has accomplished and needs to do further. And also to create a welfare state in Korea, not only during the Moon Jae-in administration, for the incoming administration as well. We need these types of discussions to continue. And I think that we have to look at the potential and the limitations and room for improvement and find ways to improve. So we need continuous research, study, and also better policy recommendations. So I would like to thank everyone for joining us until the very end of the session. I thank those joining us via online channels. And this is recorded, so if you're watching us later through the recorded version, I thank you all as well. Especially, I would like to thank our discussants from the US, Dr. Yoon Jung-ho, and from France, Dr. Pellier and Dr. Adema. Thank you very much for joining us. And I apologize for not being able to provide you with ample time, for not being able to provide you with sufficient answers to your questions and comments because of the time constraint. I assure you that I will provide an opportunity through my institution so that we can engage in a more in-depth discussion in the future. So once again, I thank the speakers and the discussants and our audience. Thank you. And with this, I would like to conclude session 2. Thank you.
네, 고맙습니다. 다시 한번 제2세션을 맡아주신
Yes, thank you very much. Once again, I would like to thank the moderator, President Lee Tae-soo of the Korea Institute for Health and Social Affairs, the speakers, and the panel discussions. Especially, I would like to thank the discussants who joined us from abroad. This concludes the first day of the Inclusive Korea 2021, which is being held under the theme of Inclusive Society and the 4-year journey of the Moon Jae-in administration. The presentations can be downloaded from the Inclusive Korea website, and the videos can be viewed through our YouTube channel. Tomorrow, we will be hosting the second day. We have various sessions prepared, so please, we ask for your continuous interest and participation. We will begin at 9:30, and the sessions will be aired live via our online channels. Thank you very much for joining us. I'll see you tomorrow.